At first hand, this might look like a very logical case. We see a large artery and we see cardiac muscle, and we see the large artery completely lying within the subendocardial fat. We could see some autonomic nerves and some smaller vessels in the subendocardial fat as well. In addition, the myocardium does not look uniform. You could see whiter areas here and here and here and here. So let's try to be logical, and let's say that this is a large artery. You could already see that most of its lumen is obstructed. Most of the reason for the obstruction is atherosclerosis. You can see that there are perhaps small areas of calcification. This is all plaque and fibrous tissue and foamy histiocytes. Here's some residual portion of smooth muscle, a large artery. In addition, what was left then of the lumen, which looks like it's a relatively small percentage of the artery, in addition, looks like there may be some thrombosis as well, because you not only see blood in there, you could see little tissue fibers, and perhaps just some organizing phase of an infarct, perhaps in the days to weeks period. Now that we're thinking very logically, let's look at the heart that this artery was next to. We've already commented that it was non-uniform, and if we were really smart, we would think, well, looks like it's pretty much infarcted with old atheromatous disease here and a fresh or recently organizing infarct here. So this must be an infarct. Okay, it is. But let's say three simple things. If the infarct was very, very, very fresh, it would be edematous. There would be infiltrates of neutrophils, and there would be a situation in which you couldn't see the nuclei of the skeletal muscle fibers either. If it was very, very old, it would be nothing but scar tissue. But it's neither of those two situations, is it? It's not very recent, and it's not very old, or what they call healed. The main picture that we see here, these whiter areas within the myocardium, consist of a lot of blood vessels, like here and here and here and here and here and here and here. And most of these white cells are white because they are histiocytes. They're foamy histiocytes. So in the organizing phase of infarction, like the organizing phase of inflammation anywhere, you can have an ingrowth of these macrophages or histiocytes, and soon followed by these budding endothelial cells and blood vessels here. In addition, if you look a little closer, I could convince you that some of these little pigmented cells here, which I hope we can see pretty soon, are incinerin cells, or there's areas of hemorrhage which were gobbled up by the macrophages. And you could see one here, you could see one here, you could see one here, you could see one here. So histologically, the hallmark of organizing inflammation or organizing infection is ingrowth of histiocytes and ingrowth of blood vessels. This would also be similar to the granulation phase of healing, which is usually several days, maybe even to weeks after the acute phase. The acute phase is characterized by neutrophils. A healed or remote phase is characterized by scar tissue, and this is the intermediate phase, or the organization phase, or if you want to use the word granulating, because this looks a lot like granulation tissue, knock yourself out. That's fine with me. Thank you very much.